Dear colleagues, welcome to this symposium organized by Omron Healthcare Europe with focus on the clinical value of patients' home monitoring of real-time blood pressure and electrocardiographic atrial fibrillation assessment, which is done using a one-lead rhythm strip. Both measures can easily be obtained in the patient's home with high accuracy, the ideal home monitoring approach at the patient's convenience. Now, why is this important? It's well known that both hypertension and AFib are both crucial risk factors for developing stroke and cardiovascular events, such as myocardial infarction or even heart failure. But at the same time, if hypertension and/or atrial fibrillation are detected at an early stage, these risk factors are modifiable, and debilitating consequences of stroke and other cardiovascular events can be prevented. In the symposium of today, we have excellent speakers. Professor Gerhard Hendricks from the Cardiovascular Center in Leipzig, Germany, an expert on AFib, who was the co-chair of the ESC 2020 guideline on atrial fibrillation. He will address the current recommendations in the diagnosis and treatment of atrial fibrillation. Professor Keitaru Senu, our second speaker, comes from Kyoto University in Japan. His lecture concerns the validation of innovative technology to detect and diagnose hypertension and AFib simultaneously with a single device named Omron Complete. Prior to these two lectures, I will provide you with a brief introduction on prevalence and outcomes of hypertension and atrial fibrillation. I hope you enjoy. So hypertension and atrial fibrillation, these are two diseases that coexist very often in our patients. Let's talk first about the definition of hypertension, because that's probably the cornerstone of all this. Normal tension is systolic lower than 120 millimeters mercury and diastolic lower than 80 millimeters. We then define pre-hypertension as systolic pressures being between 120 and 139 and diastolic between 80 and 89 millimeters of mercury. Stage 1 hypertension is systolic blood pressure between 140 and 159 millimeters of mercury, whereas the diastolic pressure is between 90 and 99 millimeters of mercury. Stage 2, severe hypertension, there the systolic blood pressure is 160 millimeters or more, and the diastolic is 100 millimeters mercury or more. This is according to the ESC guidelines definition that were published in 2018. I give you some facts. So the most common primary diagnosis worldwide is hypertension. Hypertension is the #1 risk factor for global health, and hypertension is a major risk factor for stroke, myocardial infarction, vascular disease, and chronic kidney disease. So more facts. Hypertension is the worldwide prevalence in adults around 30 to 45%. Many patients are suffering hypertension. The prevalence of hypertension in Europe ranges from 9 to 20% in the adult population and ranges from 44 to 60% in the elderly. More than half of the elderly patients have hypertension in Europe. But what is even more important is the awareness. Only 50% of our patients with hypertension are aware that they have it. And only if they're aware, we can treat them. What is key important is that hypertension is the most important modifiable risk factor for cardiovascular disease, the leading cause of mortality in Europe, stroke, end-stage renal disease, and peripheral vascular disease. The key message to you is if you diagnose it, you can alter outcomes. And despite intensive medical therapy and our guidelines, we still see not much of a reduction in prevalence. The blue curve shows over the period of 2000 till 2016, a straight line. The hypertension prevalence is staying exactly the same, despite all we do. We control it better, for sure, but the prevalence does not change. With the aging population comes an increase in hypertension prevalence. The older our patients become, the more often they have hypertension. And you see here in these bars, if you focus on each group, total, men and women, each group, the most right is the light green bar, is the patients of 60 years and older. Look at those numbers, 63% in total, 58% in men, and 60+% in women. this is the disease that is most prevalent in our patients. Hypertension is associated with worse outcomes, and specifically when left untreated and uncontrolled. If you focus on the two curves at the bottom, these are the red and the purple one. These represent the undetected or uncontrolled in purple, or the untreated in red. And you see that these patients actually have the worst outcome. Untreated, uncontrolled, undetected is associated with the worst outcome. We realize that there is an important relation between hypertension and atrial fibrillation. And how does that work? Well, long-standing hypertension results in stiffness of the aorta, aortic stiffness. And aortic stiffness in turn results on left ventricular hypertrophy and increased LV and diastolic pressure. And when left ventricular hypertrophy and increased LV and diastolic pressure occur, the next thing to occur is left atrial dilatation, which is then easily followed by atrial fibrillation. This slide explains, in a way, the interaction between hypertension and atrial fibrillation and or flutter. If we focus on the part in the black circle, you see that older non-diabetic hypertensive patients with lots of comorbidities often develop new onset atrial fibrillation. And that in turn increases the risk of adverse cardiovascular events. But at the same time, older non-diabetic hypertensive patients with lots of comorbidities have already atrial fibrillation, and that is being aggravated in those patients, which increases again the risk of adverse cardiovascular events. So the interaction between hypertension and atrial fibrillation and or flutter is detrimental. It increases significantly the adverse cardiovascular events that we would like to prevent. So the conclusions of what we have discussed previously is that hypertension is highly prevalent. Hypertension is associated with increased mortality. Hypertension is associated with cardiovascular disease and stroke. And finally, there is a strong interaction between hypertension and atrial fibrillation. So early detection of hypertension and atrial fibrillation will permit eventually earlier treatments. And eventually, we will prevent these adverse events in our patients. With that, I would like to hand over to Gerhard Hendricks, a good friend and colleague, who's going to talk about home screening of hypertension and atrial fibrillations. What do our ESC guidelines tell us?
Hello and welcome. My name is Gerhard Hendricks from the Heart Center Leipzig in Germany. It's a privilege and pleasure to participate to this symposium on arterial hypertension and atrial fibrillation. Jerome Bucks has already introduced the topic, and I have the privilege to share with you some perspectives from recent guidelines on hypertension and atrial fibrillation with particular reference to screening. These are my disclosures. Please note that I have no personal relations to disclose related to this talk. Indeed, it is well known that around the globe, millions of patients and also citizens before they become patients suffer from hypertension and arterial hypertension and from atrial fibrillation. And it's also well known that a significant number of these individuals have both states of disease, hypertension and atrial fibrillation, as there is a close pathophysiological link between both states of disease. It is very important to realize that the vast majority of these individuals may not even know that hypertension or atrial fibrillation is present. It's undetected, it's undiagnosed, with the consequence that these individuals cannot be adequately treated and protected from the devastating complications of hypertension and atrial fibrillation, stroke, heart failure, and others. This slide shares with you one perspective on the awareness of individuals having hypertension. And the same is true for atrial fibrillation. Less than 50% around the globe of patients affected with hypertension know that the disease the cardiovascular state of hypertension is present there, and we know the same from the field of atrial fibrillation. So it shows the importance of detecting hypertension and atrial fibrillation quite clearly, as this is the key to build up protection with adequate treatment. Screening for states of disease. There is a brief general perspective on this. This slide has been taken from the supplement material of the 2020 atrial fibrillation guidelines, and it rolls out what is meant when we talk about screening. Screening means that we enter a systematic program where a certain biological state is measured that is unknown at the time of introduction of the screening program. There are several screening types, screening strategies, and screening settings that can be used in order to professionally introduce a screening program, which can be community-based, it can be occasion-based, and it can also be domiciliary setting with home measurement of the biological marker. Case finding or surveillance is not screening. That is important to realize and to know. There are several technologies that have been introduced in the field of atrial fibrillation to support the idea of screening for the arrhythmia, and this has been taken from the 2020 ESC AF guidelines, showing what techniques and technologies are in principle available to screen for atrial fibrillation. The interesting idea that is also shared with you in this symposium is to combine the screening for atrial fibrillation with the screening for arterial hypertension, and the technology that offers you both rhythm and blood pressure is available. What are the potential benefits and risks for screening for atrial fibrillation? And in principle, the same does also apply for arterial hypertension. It is good to consider both sides of the coin, as there are not only benefits, but also additional aspects that need to be addressed before you go into a screening program. And the risks are listed here that we should be aware of and discuss that with the citizen or the patient, but the benefits clearly overweight the risks, because it goes on prevention of the most significant complications of atrial fibrillation and arterial hypertension, particularly the prevention of stroke and heart failure. But there is more in screening and detection. It includes also the reversal of an unknown state of disease, the end organ effects of an undiagnosed disease, once recognized, can be reversed, and health and quality, also quantity of life, can be given back to the patient affected. This has been taken from the 2018 ESC guidelines for the management of arterial hypertension, and the guidelines recommend screening a little bit in relation to the state of blood pressure in individuals if this is known. But one call is very clear from these guidelines: everybody should know his or her blood pressure, and it gets even more relevant when states of high blood pressure have been diagnosed, in order to confirm the cause of arterial hypertension, and also to ensure that treatment of arterial hypertension is adequate. And there is one clear call from these guidelines in the section of new concepts, where the guidelines clearly state that wider use of out-of-office blood pressure measurements as ambulatory blood pressure measurement, or especially home blood pressure measurement, is advised for many citizens and patients. And the guidelines give it even in more detail, as they recommend with a class 1 level of evidence B recommendation that screening programs for hypertension are recommended. All adults older than 18 years should have their blood pressure measured and recorded in their medical file and be aware of the blood pressure. And this is then further differentiated a little bit with a linkage to the risk of having arterial hypertension. Interestingly, there is a very clear call for the need of systemic screening for high blood pressure in patients older than 50 years of age. And this is particularly true when cardiovascular risk factors are present. Let's take a quick look to the atrial fibrillation guidelines. The atrial fibrillation guidelines recommend opportunistic screening for atrial fibrillation by pulse taking or an ECG rhythm strip. And a rhythm strip is an ECG recording is required for the diagnosis for patients or citizens aged older than 65 years. And this is also a little bit more diversely presented than in the guidelines where is explained the setting and the strategy and the organized structure of such a screening program with an adequate technology that allows the diagnosis of atrial fibrillation by an ECG recording. Why is that important? And this is my last slide, and it refers to some of the latest science in the field of atrial fibrillation, detection of atrial fibrillation, and early treatment of atrial fibrillation. This has been taken from the EAST trial. EAST was a prospective randomized trial where the early detection of atrial fibrillation and early comprehensive treatment of atrial fibrillation was investigated in a prospective randomized fashion. And the primary outcome of the EAST trial was a composite of cardiovascular deaths, of stroke, and of acute coronary syndrome. And you see the cumulative incidence in both groups, where rhythm control after the diagnosis of atrial fibrillation was introduced as compared to usual care. And as you can see, there was a significant difference in favor of rhythm control, showing that once you have diagnosed the state of atrial fibrillation, introduced an adequate therapy in this particular example, rhythm control strategy, you can achieve a lot for your patients to improve the quality and quantity of life. So I thank you very much for your attention, and I hand over to Professor Janu from Japan with the next presentation. Bye-bye.
Hi, I'm Keijiro Seno. I'm from Kyoto Prefectural University of Medicine, Kyoto in Japan. I'm very happy to give my presentation today. And the presentation title is the simultaneous screening for atrial fibrillation and suboptimal blood pressure control. This is my COI. And hypertension affects around half of the adult population worldwide, being one of the most common cardiovascular disorders. On a population basis, high blood pressure is considered to be the major independent risk factor for atrial fibrillation. The incidence of both diseases has increased significantly in the recent decades, and it is expected to continuously surge in the following years. Due to close relationship between the both diseases and their frequent coexistence, hypertension and atrial fibrillation become major health priorities. Given the prevalence and the frequent lack of symptoms of both these disorders, the arrhythmia screening in hypertension patients is needed. And today, I'd like to briefly talk about performance of complete wireless upper arm blood pressure monitor with EKG paired with an automated rhythm adjudication AI algorithm for the detection of atrial fibrillation, which is made by Omron Healthcare Company. And a patient were instructed to perform 2 times blood pressure measurements and 30 seconds EKG recordings of bipolar lead 1 rhythm strip by touching the electrodes located on the top face and both sides of the monitor. If a recording could not be interpreted as normal or possible atrial fibrillation, the patient were instructed to perform another measurements. Within 2 hours of the measurements with the complete devices, the 12 lead EKG recordings were obtained. This series of processes were performed before and after ablation during the patient's hospitalizations. And the baseline characteristics and measurement data of the study population are listed in Table 1. And to test the accuracy of the complete automated algorithm for detecting possible atrial fibrillation, the sensitivity and the specificity for detecting possible atrial fibrillation were 100% and 86% respectively. To assess the fidelity and overall quality of complete rhythm recordings and the transmission, the physician-interpreted complete recordings and 12-lead EKG were compared. And the sensitivity and the specificity were 99% and 84%. And next, I'd like to talk about results of the simultaneous screening study for atrial fibrillation and suboptimal blood pressure control in the elderly. The Kyoto Prefectural University of Medicine Education Initiative have been holding atrial fibrillation awareness symposium since 2019, and more than 1,600 elderly people aged more than 65 years old participated. Objectives were early detection of new atrial fibrillation and identification of suboptimal blood pressure meeting the definition for hypertension by the 2 guidelines, Japanese Cardiovascular Societies and HA and ACC guidelines. The number of registered participants was 1,648, of which 1,607 were included in the analysis after excluding 41. And the participants' background is shown in the table on the right. The average age of the study group was 72 years, with 51% females, an average CHAS-2 score of 0.9 points, and an average CHAS-BASC score of 2.5 points. And this slide shows the prevalence of hypertension. The white bar shows hypertension history, and blue bar shows systolic blood pressure more than 140 or diastolic blood pressure more than 90 on the day. And green bar shows systolic blood pressure more than 130 to 139 or diastolic blood pressure more than 80 to 89. The number of hypertension patients based on the JCS guidelines was more than 60% of all participants and more than 80% based on the ACC/HA guidelines. And let me show you the new detection of atrial fibrillation in subjects with or without hypertension. Of the 1,607 participants, 58 had atrial fibrillation and 15, 0.93%, had newly diagnosed atrial fibrillation confirmed by physician. The number needed to screening for one newly diagnosed atrial fibrillation was 106. And a new atrial fibrillation was found more in subjects with hypertension, 1.59%, compared with those without hypertension, 0.51%. And the diagnostic yield of screening programs can be enriched by targeting populations with a high prevalence of atrial fibrillation, particularly the elderly and those with more than one risk factors for atrial fibrillation, such as hypertension. And we are currently conducting several studies to gain new insights into the relationship between the hypertension and the atrial fibrillation. I will briefly introduce them today. And we are doing multi-center prospective observational study by using this blood pressure monitor with EKG. The study population is 100 persistent atrial fibrillation patients undergoing catheter ablation. And the primary endpoint is the time to atrial fibrillation detection in comparison with the usual care during the follow-up. And the secondary outcome is an agreement between the Omron devices and the standard Holter monitoring performed every 3 months. And the patients are routinely followed up in clinical practice because the results of the device are blinded to both the patients and the clinicians. And we have completed all the patient registration and are now following up those patients. And this is the last slide. So we will investigate a detection rate of subclinical atrial fibrillation in hypertension patients over a 3 months period and identify the risk factors and construct an AI model to prevent atrial fibrillation occurrence. And the EKG information just before the onset of the atrial fibrillation will be machine learned. And in the future, the early signs of recurrence of atrial fibrillation will be detected, and feedback will be provided to patients. And we are planning to target 4,500 people aged more than 60 years with hypertension and undiagnosed atrial fibrillation. This virtual clinical trial is scheduled to begin later this fall, and I hope that you will look forward to it. Thank you very much for your kind attention. Thank you.
Well, colleagues, this was a great symposium, and I have 2 questions coming in. The first question goes to Dr. Gerhard Hendricks. So, Professor Hendricks, dear Gerhard, nice to see you. And the question for you is, what is the most important clinical advantage of a home blood pressure measurement with ECG function for a medical specialist, a doctor like us or anybody working in the healthcare? Gerhard, what do you think about that?
I think this represents a significant step forward. This symposium has now nicely outlined that there is a very strong association between atrial fibrillation and hypertension, and to come up with a technology that gives us the opportunity to screen on both sides, on the hypertension side and on the rhythm side, is a unique opportunity to improve the recognition of undetected arterial hypertension and of undetected atrial fibrillation. I believe it's a significant step forward in order to reduce the number of citizens at risk that have not been appropriately diagnosed and cannot be protected.
Thanks very much, Gerhard. And I really like that you emphasize citizens, because indeed, it's a lot of people who don't know that they are at this risk. Let me now turn over the microphone to Professor Senou. Welcome, and really fantastic lecture that you put forward. And my question to you would be, that comes from the audience, is what is the most important advantage of being able to monitor blood pressure and record an ECG at home for a patient? What do you think?
Thank you for your question. So the hypertensive patients have a high incidence of AF. So early detection of AF by measuring the EKG together with blood pressure can lead to treatment of the atrial fibrillation itself. And hypertensive patients with detected AF are also at a higher risk of stroke and heart failure. So the daily blood pressure and heart rate alerts reduce these risks. And this device is designed to measure blood pressure and EKG at the same time, so there's no need to take extra time for EKG measurements. Therefore, a higher retention of the measurement would would further increase the chances of atrial fibrillation detection.
Wonderful. Dear both speakers, I think you did a great job by positioning that. And to all of you at home, we have a lot of more questions coming in, but due to time restrictions, we cannot address those right now. I would say we enjoyed a very, very interesting symposium on a very clinically relevant topic, namely early detection of hypertension and or atrial fibrillation. And with the Omron Complete device, this early detection has now become a reality, performed by the patient in his or home situation. And this home assessment will significantly reduce cardiovascular events and improves patients' quality of life. I want to thank you for joining us. I want to thank the speakers again for their wonderful talks. I want to thank the audience for engaging and raising these questions. Thank you for joining us today, and I hope you enjoy this wonderful ESC meeting.